Now, when talking about the naming of benign tumors and malignant tumors, there are some pretty good rules of thumb to remember in that benign tumors typically end in oma, with the suffix oma, and malignant neoplasias end in either carcinoma or sarcoma. And you know why they might end in one versus the other when we're talking about malignant tumors? Where are carcinomas classically derived from, embryologically? The epithelial layer. What about sarcomas? The mesenchymal layer. Very good. So this is just kind of a very general rule of thumb to keep in mind when you're thinking about tumor nomenclature. Okay, so now let's briefly talk about a few sample tissues of the body, and what the benign and malignant counterparts are that they can progress into. So let's start off with an epithelial tissue, let's say colon. Okay, benign counterpart is a tubular adenoma that we see here. All right, just a little nubbin on the intestine, and if it's left unattended, these can actually keep growing and progress. If no one gets a colonoscopy at age, what's the first age recommended? 50. It can progress into a full-blown adenocarcinoma. Quick question for you, how would this patient present? Okay, it looks like it's hemorrhagic, they're losing blood, and it's taking up space in the colon, so stool doesn't pass as easily. So blood loss, anemia, they might be fatigued. Decreased stool passage, they might be constipated too, and bloated. Okay, how about blood vessels? This is so commonly tested. You see this in a newborn infant, and it's actually grown in the first few weeks of life. Parents are really worried about it. What do? Do you cut it off? Do you burn it? Do you freeze it? Or, right answer is you leave it alone, because this is a capillary hemangioma, and they almost always spontaneously regress and are gone by pretty much 15 months of age. Okay, a malignant counterpart is an angiosarcoma, and this is often in the liver, especially after exposure to, and we'll talk about this later, polyvinyl chloride. All right, you have a young, actually, I would say middle-aged African-American woman who has severe pain and very intense menstrual cramps. And you take out her uterus, you see these. What are they? Uterine leiomyomas, okay, benign, symmetrical round growths of smooth muscle. Now, what's the malignant counterpart to these? Leiomyosarcomas, much more deadly, much more fast growing. Okay, so it's just a nice comparison, that's the point of these examples, between slow growing, usually round symmetrical, fibrous encapsulated benign tumors and their malignant, fast growing, necrotic, metastasizing, deadly counterparts. Last one, real quick, bone tissues. What's this? A small benign outgrowth. Pretty common. It's an osteoma. Now, this next one is pretty commonly tested. A teenage athlete who has increasing thigh and knee pain after minor trauma, like when he's in football practice. An X-ray shows Codman's triangle or sunburst appearance. What is this? Osteosarcoma.